I want to thank Dr. Katzman for being with us this morning to talk to us about the issues around COVID-19 and how uh, the program that you have set up for first responders has evolved. And of course, that's because things have changed so drastically in the last 3 months or so. And what I'd like to talk about, what are some of the subjects that have been discussed and taught to our first responders by Project Echo? Can you give us a few examples?
Thanks, Ernie. Since the uh, COVID-19 crisis, we really evolved this program into a program about resilience and building resilience for first responders. And we've also expanded a bit our idea of who a first responder is, because so many of us are directly involved in the scene. So it has attracted the attention of lots of healthcare workers and therapists also around the world, I would say. And we started with the idea of incorporating the principles of what's called psychological first aid, which is an intervention to help people know what to do when coming to a crisis. And the primary tenets involve engagement and communication and how to listen when we're working with people, how to mitigate a bit and make interventions to help people, and then how to refer somebody and develop an action plan cooperatively together to really help somebody with the problems that they're facing. And so we incorporated that, but actually really first started with ideas about self-care and how we can take care of ourselves, because nobody can help other people if we are anxious and having trouble ourselves, which most of us are. The unique thing about this crisis is that we're all in it. And for first responders in particular, and healthcare workers, each time we meet, there's a risk involved, and we have to think about that and think about how we can stay calm with our feet on the ground while we're attuning to and reaching a hand out to other people. So we've really focused on self-care and then the principles of psychological first aid, and it's really become, I would say, a community of resilience building, and a place to do that. So we have now talked about the relationships in our lives, and how those have been impacted by this situation, all in different ways. Some of us find ourselves quarantined and separated from the people that we love. Some of us find ourselves isolated. Some of us find ourselves in suddenly with adult children who are home, and suddenly, and many of us find ourselves in situations where we can't actually be with our loved ones because of the risk of infection from the job that we do. And so we've gone through ideas about how to navigate issues of relationships, and then we've talked about kids. There's been a lot of interest on the call about children and how to help children. Again, that involves parents being calm themselves to be able to listen to and attune to children. And we're now going in the next weeks to understanding how the principles of psychological first aid can help us to build a sense of community resilience, and how we can understand how to come together as a community to help one another. And, and that, of course, incorporates the other current situation around the conversation about race and police, which has been an interesting experience, honestly, as we've had a very diverse group of participants on the line.
You've talked about some of the different subject matter and maybe some of the other subjects that will be coming up. And you mentioned there's some concerns about children. And I imagine about the first responders and how they're worried about their children and how they could be literally contaminated by their parents who are first responders. Are there other very significant issues or concerns that first responders have that Project Echo will be addressing in the near future?
Yes, there's so many, and they're diverse group of issues. Some of them involve the stigma, actually, of being a healthcare worker and first responder, and people honoring and feeling such gratitude toward healthcare workers, at the same time wanting to kind of stay away. And people have described actually responses of their neighbors because of not wanting to be infected, and the problem that arises. A lot have expressed the lack of clarity around guidelines such as, should you live with your children or not? If you're a healthcare worker, if you're working in like a medical ICU, or if you're a first responder, we don't really have clear guidelines, and so we're often left to our own. Certainly, what I would say is the most powerful thing that's happened in the program, though, is we also identified that Zooming has led to really an experience of passivity, which is already such a part of this experience. Lots of us can't get in our car anymore and go to work in the same kinds of way, and are staring at computers for hours at a time as passive learners. So we decided to limit the presentations to 20 minutes after about the first 4 or 5. And now have the last 3 weeks had breakout sessions where all of the participants are randomly assigned to groups of about 15, each with a leader. And really, it's a place where people can connect and share stories, and on the model of what we've called listening groups. Those are formatted after the listening groups in Africa, where people heard information on the radio in villages and came together to share information. And this is really a place where we listen to each other, understand each other's perspectives, and come together. It's not a therapy session per se, but a place where we can actually be heard and hear other people to build a stronger sense of community and connection, which seems to have been a very powerful experience over the last 3 weeks.
Dr. Katzman, I really appreciate you taking time to visit with us this morning, and we wish Project Echo all the best to continue the great work that you're doing. Thank you again.
Mm-hmm.